As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccine acceptance.
Never in our history has there been a more urgent call to stand united. Get vaccinated. So together, we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna, now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
When it comes to how many kids Filipino couples want to have and how many kids they end up having, meron tayong nakikitang pattern. Parents usually end up with one child more than what they initially wanted. At ang pinakamahihirap na pamilya, sumusobra pa sila ng dalawa. Pag mas malaki ang pamilya, mas lumalaki rin ang posibilidad na maging mahirap ang pamilya. Poverty leads to children growing up not reaching their full growth and productivity potential. Responsible parenthood and family planning is one of the 3 program components of the Philippine Population Management Program. Tugon ito sa pangangailangan para sa epektibong pagpaplano ng pamilya. RPFP has 3 goals: zero unmet need for modern family planning, pataasin ang paggamit ng modern contraceptives to 65%, at maiwasan ang di inaasahang pagbubuntis, lalong-lalo na para sa mga mahihirap na kababaihan. Sa RPFP, matutulungan ang mga couples na ma-achieve ang tamang pagkaagot ng pagbubuntis at ang bilang ng gusto nilang maging anak na kayang bigyan ng maayos na tahanan at kinabukasan. Tagumpay iigtingin ng kampanya para maipatupad ang Responsible Parenthood and Reproductive Health Law at Executive Order No. 12 sa mga lokal na pamahalaan. We'll use communication campaigns to promote responsible parenthood and family planning, natural man o artificial methods, upang tumaas ang demand para rito, especially among poor women and families. Ilalapit natin ang reproductive health services at contraceptive commodities sa mga mahihirap na komunidad para ma-access ng sino mang gustong magplano ng pamilya ang family planning method na hiyang sa kanila. With the Responsible Parenthood and Family Planning Program of the Philippine Population Management Program, we'll make sure that couples and individuals have the knowledge and support they need to start the family of their dreams. Empowering Filipino families.
Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag ka agad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
B-I-D-A. Be the solution sa COVID-19.
Magandang gabi po sa iyong lahat. Welcome back to yet another episode of Alaga Health Live's Checkup. And nandito po tayo tuwing Sabado para sagutin ang inyong mga katanungan tungkol sa inyong kalusugan. At ngayon, kasama natin ang ating mga eksperto at tayo natutuwa dahil bibigyan nating focus ngayon ang Patient Safety Awareness Week, no? At dahil po, yan ang ating topic. Nako, umpisahan nating i-introduce ang ating mga kasama ngayong gabi. First up, let me introduce my co-host this evening, the one and only Dr. Via Roderos. Good evening, Doc Via.
Good evening po sa lahat ng ating mga viewers. Nako, 1 week din tayong nagpahinga, Doc Dex, no? And I'm so glad that we are all feeling well, especially you, Doc Dex. And I hope po sa ating mga manonood dyan sa kanilang mga bahay po, kayo po ay feeling better. And we're gonna have another exciting session. I'm personally excited again for this one. Hope every week na lang po na-excite mo ko sa Alaga Health Live because you will be joined by one of our dear mentors and friends. No? So, Doc Dex, without further ado, pakilala na natin.
Yeah, and so we have two guests this evening, no? And first up, let me introduce to you one of my favorite people in the world, one of my mentors during my medical training, and he is actually an occupational medicine specialist, no? An OcuMed doctor, and of course, no? Siya ay napakagaling talaga mag-explain. Kaya tuwang-tuwa ako na kasama natin siya this evening. He is the one and only. Let's all give it up for Dr. Jhason Cabigon. Good evening, Doc Jhason.
Good evening, Doc Dex. Good evening, Doc Via. So, good evening sa lahat na nakikinig.
Thank you, Doc Jhason. Thank you for joining us, no? Pero ang maganda kasi dito sa Alaga Health Live, we do not only highlight yung ating mga physicians, but we also highlight all our other health partners in providing care. At of course, kasama dyan ang ating mga nurses. So we are very privileged to have with us one of our dear friends of the show. First time here in Alaga Health Live. Let's all welcome. He is actually an ICU and an anesthesia nurse, and he's coming in to give us some tips on how to better take care of patients that are possibly at home. So let's all give it up for Nurse Benj Foscablo. So good evening, Nurse Benj.
Hi, good evening, Doc, and also to Doc Via, and also to Doc Jhason. And of course, to all of the listeners or viewers of this page, The Alaga Health. It is my pleasure to be or to joining with you guys for this, productive and purposeful night with you. And of course, for all the viewers and to all who can see this video worldwide. So, nice meeting you.
Yeah. Thank you so much, Nars. Actually, mayroon na tayo mga responses kaagad from the audience, no? So, it looks like one of our dear partners here in Alaga Health, Doc John Referial, is watching the show at home. So, good evening, Doc John. Hi daw to the Alaga Health team. And yes, do not forget to also watch our other show, Alaga Health Live presents Happy Hour for Mental Health. Every Friday naman po iyan, no? Dito lamang po sa Alaga Health page and of course on our YouTube page. And even using the Alaga Health app. We'll tell you more about that in just a few moments. So let's get right to it. Maybe we can kick things off by discussing our main highlight for the week. And maybe we can do that with our very quick Alaga Health checkup. Okay, so it looks like we have a bit of technical difficulties, but let's jump right into it pa rin, no? We can probably ask Doc Jhason. Doc Jhason, as an occupational medicine specialist, can you tell us more about bakit ba napakahalaga po ang patient safety, not only in the context of the hospital? Pag sinabi po kasi patient safety, parang isip nila kaagad, nasa hospital kaagad yung setting. It can actually even be at home or even at the workplace kasi yung mga pasyente pwedeng they can still be going to work or probably doing something else. So any thoughts on this, Doc Jhason?
Yeah, good evening again sa lahat and good evening sa lahat ng nakikinig. So thank you very much for giving me this opportunity, no? So first, to promote basically yung field namin, the field of occupational medicine. So basically, to answer your question, that is very in line, no, with the advocacy of occupational medicine. So occupational medicine is actually a branch ng ating preventive medicine. So as the name implies, our measures basically, including patient safety, will be there to prevent no serious injuries and illnesses. So yun ang pinaka importance no sa atin. With uh, with guidelines, no, certain advice, for example, we will be able to prevent no, not only sa hospital, tama kayo, also in the workplace, and also it can also be applicable sa ating mga bahay.
Yan, thank you for that, Doc Jason. No? Ang maganda kasi dito, we are talking about prevention. And of course, pagdating dyan, kasama din yung pagpo-promote natin ng wellness even outside the home or the workplace. And it's good to highlight then that occupational medicine is actually an integral part no of our everyday lives. I'll ask Nurse Benj, as an ICU nurse, ano sa palagay mo yung mga pinaka main concerns and issues ng ating mga viewers pagdating sa patient safety?
Yeah. So, collectively in the community or in the general public, sobrang importante po na matingnan ng bawat isa sa atin, ng bawat pamilya natin, yung importance ng health natin. In this current pandemic, amidst this crisis that we're facing right now, marami po sa mga tao sa community na natatakot mapunta sa hospital. But unfortunately, if the faces health problems, talagang wala silang option but to seek for consultation, to seek for medical specialties for them to get well. So, with your question, Doc, so for sure, everyone naman gusto talagang ma-maintain yung normal status nila in life, yung health nila. But of course, as a nurse in the hospital, we can't deny the fact that some of the hospitals are full because of the challenges that we are facing right now. But it's a big part in every one of us in the community, most especially na yung wala pa sa hospital, na how to give extra a burden sa healthcare system natin ngayon, and it is important for us to be healthy at home. And as a nurse din, sobrang nakikita din namin kasi yung struggle ng mga patients in the hospital. All of our patients are experiencing a lot of burden because mahirap nang ma-hospital at this point. So sobrang importante po na dapat mapansin po ng bawat isa yung importance ng health.
Thank you so much, Nurse Benj. No, that's true. Every day you can hear sa news na puno na yung mga hospitals, the nurses and doctors are tired. And hopefully, we can keep safe. Whether you are at home or if you have a family member who's in the hospital, everyone can remain safe and well, especially during this time. So let's jump into our questions from this evening. So we have a couple of questions from the Alaga Health inbox, and we will be shooting them at our special guests this evening. So first up, we have a question from Sir Henry Dimalanta. Yan. So, hello po mga doc. Sinabi po sa amin na mag-home quarantine kasi na-expose daw po si nanay sa may COVID. Ano po ba ang dapat gawin? Nako, Doc, via mga common questions to, no? Especially na ang dami na nating terms sa kanya. May granular lockdown, may alert level 4, may MGCQ, lahat na daw ng labels na bigay na natin. And of course, takot yung mga tao to go out. Any quick response to this, Doc Via, before we throw it to Doc Jason?
Oo, and I think, kanina nung nagsasalita sila Doc Jason, parang ulit akong nasa classroom, no? Because that's how really Doc would explain the concepts, no? Pero I think this is a question that would need answers from different fields of healthcare, no? From occupational health down to nursing. Kasi, for example, if you're gonna do home quarantine, tapos, for example, ang ating pong mga parents, ang ating mga nanay, tapos may mga comorbidities, how do we care for them at home? So, one thing for sure, is for us to be able to do yung sinasabi nga natin home quarantine, and before that, no, we have to get tested first, especially if we're exposed, no? Kasi whether or not we're negative or positive, sa guidelines po natin, especially dun sa Department of Health, kailangan pa rin po nating mag-quarantine, no? Because meron po kasing time, no, na baka we tested too early, no? Especially if we're not symptomatic, no? And hindi natin alam kung kailan tayo na-expose, no? So it's important for us to, number one, get tested first, no, to know our status, kung positive ba tayo or negative, and to do home quarantine, no, for 14 days, whether we're negative or positive, no? And, you know, being in the home, no, we would also have to take care of our health. So I think in terms of making the home a safe place for us to be treated or for us to be managed dun, not only for COVID but also for other diseases, no, pwede siguro tayo makahingi ng advice from Doc Jhason and Nurse Benj, no, given na home care ata na right now is sobrang necessary.
Yan, perfect. So, Doc Jhason, any quick advice po sa ating viewer na nagtatanong, ano daw po ba ang dapat i-consider kapag sila ay pinapag-home quarantine? Kasi yung iba talaga, Doc, hindi talaga sila familiar sa mga dapat na protocols. Ihiwalay ba dapat yung kubyertos? Talaga mga dapat hindi sila nagtitinginan? Ano ba talaga, Doc, yung dapat nating i-consider kapag nag-home quarantine?
Yeah. Actually, Doc Via, no, mentioned most of the things talaga na dapat talaga natin gawin, no. Siguro ang madadagdag ko lang will be, siyempre sa umpisa, we must do a proper risk assessment siguro before we proceed sa ating mga protocols. So kasi we were more than a year already into the pandemic, and yes, no, sabi nga ni Doc Via, sobrang dami na nating protocols talaga in place from DOH, from IATF, no, and even from professional societies. So kailangan natin ma-detect if really enough talaga or appropriate, we call it appropriate, ang exposure. And then once deemed appropriate, we will now proceed to those protocols. Now let's say, doon sa question, I'm assuming doon sa question ni Sir Henry, na talagang na-consider talaga na exposed, no? Na talagang significant ang exposure. Well, the first thing talaga na kailangan nating isipin will be the prevention of spread, no? When we say exposed, it only means that there is a chance that you actually acquired the disease, acquired the virus, not necessarily you're symptomatic pa, and there is a chance also to spread that virus as well. So the moment na na-deem talaga na significant exposure, that person should isolate immediately, no? And when we say isolate, as the name implies, talaga hihiwalay siya from the other household members. Separate ang room, no, ng patient na yan, no? Meaning to say, all of the interactions, if not, no, kung pwede, wala talaga interaction with the other household members, but kung meron, very, very limited. No, kung lalabas man, let's say that isolated patient will not have a separate bathroom. So make sure that that patient, kung lalabas ang isolation room niya, no, will be wearing mask, will be, kung kaya pa nga, mag-wear pa nga ng face shield, no? And of course, disinfection palagi. Not only yung kamay, but also the bathroom, no? Disinfect before and after use. Kasi ang goal, actually, the logic lang naman is to prevent the spread sa iba. And another important, this is a common question. Kapag may naka-quarantine ba, for example sa bahay, the moment na isolate na natin yung patient na yan, pwede na bang umalis yung ibang mga household members? Of course, kapag may naka-isolate po sa bahay, better po na naka-quarantine po yung buong household members. Again, there is a chance already kasi na ma-spread.
Thank you so much, Doc Jhason. No? I'll ask something related kay Nurse Benj. No? Kasi for sure, si Nurse Benj, nag-duty yan. So, araw-araw yan or every time na mag-duty siya, na-expose yan possibly to COVID. Ano yung mga protocols na ginagawa mo, Nurse Benj, as soon as you arrive home para ma-ensure na walang may mahawang kapatid, magulang, kamag-anak, when you arrive home para ma-ensure din natin na yung mga friends natin that are watching na possible na yung mga kapamilya din nila ay lumalabas pa rin because of necessity, ay mag-ensure na sila ay safe. So any quick response, Nurse Benj?
Alright. You know what, Doc Dex, with our current situation amidst this pandemic, sobrang laking tulong po or sobrang laking bagay po if every one of us are following the standard precaution, you know, the universal protocol One of it is, the social distancing, washing of our hands, using of our face masks, our face shields, for us to get protected, not only by ourselves but our family. In the situation that was raised by Sir Henry, na-expose po yung one of the member of the family. It is more important for this moment that every one of us should, titingnan natin na lahat po is infected para sure po tayo. Hindi po tayo makakasiguro that even our family, it's sad to say, the new normal is currently happening for us right now, that as possible, even in our home, basta may kasama po tayo, if we're facing different people, even our family, our kids, our partner, yun po yung malungkot ngayon. Dapat titingnan po natin kung talagang gusto po nating maging safe, titingnan po natin na infected sila. Sad to say, kasi hindi po natin alam kung from now on, every time and then nakakakuha sila or infected sila ng virus. But in the category of a high risk and low risk exposure, like for example, we do in a public transport, kasama natin sa jeep, for example, hindi natin alam na yung katabi natin is infected pala. So titingnan natin if we are low risk or high risk. So if we are high risk, like if we're not wearing PPEs, if we're not wearing mask or face shield, if we remove our mask or face shield, na the time na na-expose tayo, that's the time na high risk tayo, and possibly makuha natin or ma-infect tayo with the virus. So yun po, if someone of us was exposed and there's a high risk exposure, so possible na talagang makukuha natin yung virus. So yun, titingnan natin yung self-monitoring, titingnan natin if if ever nakuha natin yung virus, possible in more experiences na talagang nagkakaroon sila ng symptoms. So pag the time na alam natin na may high risk tayo from outside, so dapat alagaan na din natin yung pamilya natin if as possible mayroon tayong PPEs, we're wearing mask, and i-maintain natin yung social distancing sa kanila para at least maiwasan natin yung transmission. So I guess for me as a nurse, kasi sobrang nakakalungkot po yung reality ngayon kasi yun nga, madami talagang cases hanggang ngayon at hindi po talaga bumababa yung daily rate natin. And siguro mas malaking bagay kung sinusunod po natin yung universal and the standard precaution, the best thing that we can.
Thank you very much, Nars Benj. No, comprehensive answer from prevention to even care na, no? So let's jump
to occupational health, Dr.
Diba? Sobrang swak na swak talaga how it's like sa prevention aspect and promotion sa occupational health all the way na abot ICU. So yung entire expanse na response covered natin tonight. So ang ganda.
You can also share your experience, no? Because knowing
that's true. That's true. But before I do that, very quickly, like to do a quick shout out. Meron tayong viewers watching all the way from Houston, Texas. Thank you very much for watching Alaga Health this evening. So let's jump to first a quick soundbite lang. No? Hello. Hi. Here's the quick kwento, no? Actually, Doc V and I battled COVID over the past week. Kaya po wala kami last week because we were battling COVID in different ways. So si Doc Via was actually helping manage a COVID-positive patient off-site, habang ako naman managing myself and my family within the home. So parang naki-check upan kami sa lahat sa mga video chat dyan, tsaka messages lang na pinapabigay. So very, very interesting tong topic. Parang medyo nasa swak dun sa experience natin, Doc Via. So let's jump to the next question. Ito, from Ma'am Leia Salvador. So, hi Alaga, I'm already looking forward to when my employees can go back to work. Sana all. Any advice on what to prepare for? I'm in the food business, by the way. Thanks. Ayan. So, I think saktong-sakto to para kay Doc Jhason. Doc, any advice po, especially for the business owners or the employees that are planning to or preparing to go back to work kasi eventually they hope to release na daw or bawasan yung degree ng ating mga lockdowns. So any advice po, Doc Jhason?
Yeah. So basically, very related pa rin to with the previous question. No? I would still recommend that the owner, no, I'm guessing food business owner ang si Ma'am Leia, no? I would still suggest na mag-risk assessment din pa rin siya with regards naman sa kanyang mga employees. No? So she really needs to determine yung possibility, no? Yung possibility that the employee can actually contract the disease. And basically, kapag may na-identify tayo na risk, siguro ito yung pinakamaganda, no, sa occupational medicine. If we actually identified a risk, we need to balance it with another measure, preventive measure. Like, for example, no, if that employee will be fully vaccinated already as compared to an employee na hindi pa fully vaccinated. Of course, the risk is greater doon sa hindi fully vaccinated. So therefore, you must increase your preventive measures. How? Maybe require a higher form of a mask. No, baka hindi pwedeng cloth mask lang, something like that. Make sure na meron tayong mga protocols in place that they need to follow. They need to be screened, no, not only on the time of their report sa trabaho, as early as 14 days prior. Kailangan ma-test ma-screen, no? Kailangan ma-screen nila at least. Ito bang employee na to ay na-expose sa may lagnat in the last 14 days? Ito bang empleyado na to ay nagkaroon ng simptomas in the last 14 days? Not only that, what about exposure to other symptomatic patients, not necessarily COVID-19 patients? Ito bang empleyado na to ay may kasama, anak na nilalagnat ngayon, for example? So talagang screening, no, will be the best way para ma-prevent natin yung spread ng infection. And of course, that will be all part of, again, risk assessment.
So, yeah, comprehensive discussion ni Doc. No? So, it really starts with risk assessment. No? Talagang you have to assess your employees well. Ang tanong nila, Doc, should employers consider na hindi sila magpapabalik ng mga employees nila unless fully vaccinated? Is that something that you would recommend for safety purposes? Or sapat na ba, Doc, yung parang palagi daw sila magpapatest RT-PCR o kaya yung rapid test?
Actually, as of now, the Department of Labor, is not actually recommending na talagang ang ipa-report lang talaga will be those fully vaccinated. No matter how much I want to, So kung ako masusunod, of course, I would really like everyone to report na mga fully vaccinated. But of course, because of availability of the vaccines, it's very unfortunate that some of our Filipino population wala pa ring access up to now. Disregarding yung mga talagang meron pang vaccine hesitancy. Pero meron pa talaga, di ba? We know naman that we have prioritization. Yung mga category C, medyo malayo pa sila. So, no matter how much we want everyone to be fully vaccinated, hindi pa natin kaya talaga to impose that policy that only fully vaccinated can report to work. But this does not mean na talagang wala na tayong gagawin for those na mga hindi fully vaccinated. So again, we need to enforce, we need to implement certain measures para ma-prevent sa kanila yung pagkuha ng sakit. Now, I'm sorry, what's your follow-up question?
Ay, yun po, Doc. Yun po yung main question natin for we're very interested talaga, Doc. Kasi yun yung mga considerations ng ibang mga business owners regarding yung pagbabalik ng kanilang mga employees. No? Quick segue before the next question. Nurse Benj, in your end, ano yung mga preparations na ginawa ninyo in terms of being safe? Kasi nga araw-araw kayong na-expose sa COVID-19. So, any preparations that others might consider doing para mataas yung chance nila na makaiwas sa COVID-19?
Opo. So, Dr. Dex, in response to the different, guidelines like from IATF, from our government, everyone adjusted. Like the new normal that we're facing right now. Some of the companies gives or do precautionary measures like to maintain the social distancing in a crowded areas, they put marks. So yun po yung mga major adjustments ng different companies kasi yun nga we have to follow the universal protocols for us to get not to get the virus. And I guess considering the economic status of our country, we're much aware with the news. Hindi kailangan mag-lockdown tayo all the time. Hindi kailangan mag-ECQ tayo all the time. If we can see kahit na sobrang taas pa din ng cases natin, where we come up with the GCQ guidelines kasi nga some of the or most of the companies were affected, most of our people, most of our fellow Filipinos, well, probably not only Filipinos but worldwide are affected. Well, I guess yun nga, if we're just following the guidelines, the international or the protocol that was instructed to us, I guess that's the big thing na somehow we can lessen the virus if we're keep on wearing the mask, if we keep washing our hands. Malaking bagay po yun na somehow we can lessen the spread of the virus. Yun po.
Yeah. Thank you, Nars, Benj. No? So, actually, we're about our halfway mark na towards the show. So maybe it's time for a very quick detour so that we can have our Alaga Health update. Welcome to Alaga Health Update, and I'll be showing you how easy it is again to register for Alaga Health. So again, Alaga Health is the Philippines' first digital health marketplace and health service hub, particularly for our MSME. So you can visit alagahealth.com. You can check our website so you can see why we do this, our supporters from UNDP, to all the services that we offer from telehealth to clinic appointments, to laboratory testing, and even our learning platform, no? So even our advocacy partners that are here. But what I'm going to show you, papakita ko sa inyo ngayon lahat, ay kung paano kadali mag-sign up sa Alaga Health. So pagpunta niyo sa website, pindutin niyo po itong nasa top right button, no? Sa sign up. Yan. And then, malilipat kayo dito sa ating registration page. So you can register as a patient, as a health professional, or as a clinic owner. So yan, yung patient, partner, and admin. So, since mga viewers natin ngayon ay mga likely future patients o mga papakonsulta, let's check yun sa patient. So, once you're here, just click continue. Yan. And you can actually check first and read tong Data Privacy Act natin. Please read very carefully and ensure that this is checked. And all you have to do is press continue. And you're transferred now to the page kung saan ilalagay nyo na yung inyong mga personal details. And don't worry, they're very secure. And you will secure it further with your strong password. And just like that, after filling this up, you can already become a part of the Alaga Health family. Ganun lang po siya kabilis. When we last had a patient na nandito sa show discussing live, nasa 1 to 2 minutes lang daw, tapos daw siya mag-register. And you can actually check out the application already. It's already here. It's available sa Google Play Store, no? The Alaga Health Patient app na beta version. And of course, for our health professionals, the Alaga Partners app, no? Also beta version, coming to iOS very, very soon. And even the web version. That's very, very exciting for us, especially that Alaga Health will be participating in the finals of the Globe 5G Pitch Day this coming Tuesday and was just tapped as one of the top 10 startups ng Roto Ignite events this coming October. So we're very, very excited. A lot of new developments for Alaga Health, and also special shout out to ADB for the support, the funding, and of course the guidance as we push the launch of the Alaga Health platform. So balik tayo ngayon sa ating mga questions. So maybe Doc Via can highlight this kasi mukhang something very related to, I think, home care or child care ito.
All right, no? So, I think we have another question, no? From, I think this is a mom, no? Si Ma'am Rain Tayag, no? Sabi ni Ma'am Rain, itatanong niya lang daw po kung paano ba gawing mas safe ang bahay para sa mga bata. Kailangan po ba talaga yung mga harang sa hagdan? Thanks, no? Although I'm not yet a mommy, no? I think one of the pinaka-best na maka-answer nito is our special guest, no? Because Dr. Jhason and nurse and our nurse here is especially equipped, no, doon sa mga knowledge natin regarding how to keep our home safe. So, Doc Jhason?
Talon tayo from COVID to talagang very occupational health related. So let's go, Doc Jhason.
Talagang across all fields pala to, no? But yes, thank you for that question. Well, as I mentioned a while ago, no, yung occupational medicine talaga will be geared towards the prevention sa workplace. No? So these are the measures, the policies, no, the guidelines gumagawa kami para ma-prevent yung injuries at saka sakit, no, sa workplace. But as I mentioned a while ago, that guidelines can actually be migrated sa bahay. So kapag ginagawa natin basically, no, yung mga preventive measures or at least the theories behind, kahit papaano may improve din natin yung safety sa ating bahay. Now in occupational medicine, the most important, no, the highest level of control will be the elimination ng hazard na tinatawag. Actually, yung question ni Mami Rain, no? Ang question ni Mami Rain will be very general, no? So maraming potential, no, na safety hazards, for example. So we must really think, syempre yung mga bata, no, they cannot take care of themselves. So dapat tayo ang mag-isip for them. So will this be hazardous para sa kanila? Tanggalin mo na kaagad yan. No, ito ba ay potential na mainom, makain? Dapat tanggalin na po kaagad yan. So we must be very proactive as parents. And then yun yung pinaka-highest level, no, ng control measure. The next level is hindi mo talaga matanggal. Kunyari hagdanan, hindi mo naman matatanggal ang hagdanan sa bahay nyo. How will you remove that hazard? So ngayon gagawa tayo ng mga barriers, no, yung tinatawag na engineering control. But don't get parang intimidated by the words, no? Pag sinabi natin engineering control, hindi naman kailangan engineering graduate ka para magawa mo yon. So basically, gagawa tayo ng mga physical na mga paraan para hindi ngayon makapunta doon sa hazard na tinatawag ang bata. And yes, tama yun. One, kung talagang sa paningin ni Mami ay posible na mahulog, consider mo na yun, naisip mo na eh. Posibleng mahulog eh, di ba? Naku, baka mahulog talaga. Sisihin mo sarili mo, pero naisip mo na, di ba? The moment na maisip mo yon, gawa na kagad tayo ng paraan. Siguro yun yung advantage ng pagiging occupational physician, no? Mga paranoid kami eh. Paranoid ang occupational physician, no? Konting, yan, pwede yan. Kahit napakababa ng chance, posible yung madulas, posible yung mabalian ng buto, something like that. So yun yung pangalawa. Now, pangatlo will be yung tinatawag na kung hindi ka makakalagay ng mga barrier, maglalagay tayo ng mga additional na bantay, for example, sa bahay. Sa opisina, ang tawag dyan, administrative control. So sa bahay, paano mo i-apply yung administrative control? Siguraduhin natin na may nagbabantay talaga, for example, sa mga bata, especially doon sa area, no, na potential na magkaroon sila ng injury o kaya ng sakit. O kaya meron lang kayong pwede kayong gumawa ng mga rules sa bahay. Itong lugar na to, for example, hindi nyo pwedeng puntahan. Explain sa mga bata kung bakit. Part yun ng administration, di ba? Natin, yung mga rules na pinapatupad natin sa bahay. So, para lang makumpleto pero hindi na applicable sa bahay, no? Pero for COVID, pwede pa rin. Yung last level ng control, yung PPE na tinatawag. No? So, yun yung 4 na level. So, elimination of the hazard, engineering control, administrative control, and PPE. In that order. Dapat elimination palagi ang pinakauna. Okay?
Yan, sobrang ganda ng sagot ni Doc Jhason. Sobrang comprehensive. Actually, that's one of the reasons kung bakit top of my mind list talaga occupational medicine as one of my areas to explore in the fields of medicine. And since nabanggit na ni Doc Jhason to, nakita ko na kasi yung mga questions na nasa inbox eh. Unahin ko nang itanong yung isa. Ito ay nanggaling kay Ma'am Erlinda Pablo. Follow-up question. Mukhang maganda siyang i-follow-up question sa nabanggit ni Doc Jhason eh. From Erlinda Pablo. Hello, kailangan po bang nakamask pa rin sa I think bahay ito. Lumalabas po kasi yung mga anak ko, baka may masagap kaming COVID. Salamat. So, advisable ba, Doc, na kahit sa bahay, 24/7 ka pa din nakamask? Or pwede naman na wala silang mask? O provided na, yung ginagawa daw kasi ng iba ngayon, Doc, pagdating nila sa bahay, at galing sila sa labas, kulang na lang, Doc, magsha-shower sila ng alcohol. Ay yung mga alcohol na continuous flow, tapos parang
May
magsha-shower sila
atomizer,
ng
may
alcohol.
ganun.
Oo. So yun yung mga ginagawa, mga nabibili natin sa Shopee, sa Lazada, gano'n. So yun yung mga ginagamit daw nila to disinfect. Tsaka nagsasabit sila ng mga purifiers. Ano yung mga suggestions niyo, Doc, regarding all of these different products and approaches?
Yes, no, medyo marami, medyo mahaba yung sagot actually sa simpleng question na to, no. Hindi ko masasagot siya directly ng oo o hindi, no. Kasi again, it will depend on the situation. Kung for example, talagang tulad ni Sir Benj, no, talagang manggagaling sa isang healthcare facility, uuwi siya sa bahay nila na may high risk. Kunyari, nandoon ang kanyang lola o lolo o kaya may mga kasama siya sa bahay na may sakit na posibleng makakuha or mga bata o buntis. No, mas maigi na proteksyonan natin sila kasi posible natin, again, parang ano lang naman siya no, parang kaya rin nating isipin, no, na kung ano yung mga paraan para ma-prevent natin yung spread ng infection. So mas maganda talaga pag uuwi tayo sa bahay, magmamask pa rin tayo, especially kapag makaka-interact kayo, no, doon sa mga high risk na yan. Ngayon, nasa kwarto ka mag-isa. Siyempre, pwedeng tanggalin mo na yung mask mo na wala ka namang interaction with the others. So, hindi naman siya talaga 24/7. Although, no, ang recommendation talaga, the current recommendation ng DOH, kahit nasa bahay ka, basta may interaction, you should wear at least a cloth mask. No, at least a cloth mask. Especially, again, kapag may interaction tayo. Now, yung mga other products, no, like yung mga air purifiers, marami, no, may air purifier na sa office, may air purifier na personal. It's actually, as of now, wala pa tayo talagang enough evidence that will actually promote the use. In fact, there are negative papers pa nga that will tell you, I think yung kiniklaim, di ba, ng mga ibang purifiers, may mga chemicals na ini-emit like ozone, di ba, narinig niyo siguro. No, pwede rin tayo magkaroon ng negative effects doon sa mga ions na sinasabi nila na ini-emit. And in fact, those purifiers, originally designed yan for for dust, for solid particulates, no. Hindi siya designed talaga para sa maliliit na mga mikrobyo, no, especially the viruses. So, yeah.
Yan, thank you very much for that, Doc Jhason. At tanangan natin briefly si Nars Benj. Sa inyo ba, Nars Benj, naka-super PPE ba lahat ng mga kasama sa bahay? O kumbaga, gumawa na lang kayo ng, sabi nga ni Doc Jhason, administrative protocols pagdating sa pangangalaga ng mga taong kasama sa bahay?
From the start of this pandemic, Doc Dex, sobrang sobrang nakakatakot on the part of our health workers, like as nurses or as you as doctors or any health workers. Kasi hindi natin alam na baka nakakuha tayo ng virus either from the hospital or from the community. Kasi nga, lumabas tayo ng bahay. Yun po yung, ngayon yung nakakalungkot na reality at as of the moment. And this, the new variant, the third wave na sinasabi natin, na kasi na yung cross-contamination happens on the family or every family members. And yun po yung reason bakit sobrang tumataas yung kaso natin kasi bawat member ng family is na-infect na with the virus. So, I guess yun nga po, if we can do the whole or all of the precautionary measures that we can, if we're just considering everyone as infected, even the member of our family, somehow, malaking bagay po yun na somehow maiwasan natin yung virus. Yun nga po, every time nga po sana, kapag lumalabas tayo, anyone, wala pong discrimination with the age, either bata ka man or matanda ka man, kailangan talaga nating mag-mask po or susundin po yung mga health guidelines na somehow malaking bagay po yun na maiwasan natin yung virus. Yun po.
Thank you, Nars Benj, no? So thank you for that. I think yung next question natin, medyo segue tayo ng medyo lalayo ng konti sa COVID-19, pero more on general wellness, no? And I think makaka-input din dito si Nars Benj kasi part ng mga roles ng nurses ang pag-explain ng mga bagay-bagay sa ating mga pasyente. So, ito ang question, kapangalan ko pa pala, from Dexter Fajardo. Good eve po. Tanong ko lang po, kailangan po bang inumin pa rin ang maintenance sa high blood kahit po nag 120/80 na po ang BP ko yan? So, let's have a tandem response question from Doc Via and
Doc Dex,
Nurse
naalala ko
Benj.
to, tinanong ko to kay Doc Jhason nung second year ng med school. I'm not sure, Doc, kung naalala mo, Doc, pero tinanong ko to sa'yo.
Yeah. Nako, no. So, si Doc Via. So,
Competing
check tayo ni
circle of
Doc Jhason. Mag-revalid na ulit. Okay, let's go, Doc Via.
Alright, siguro. From I'm sure masasagot ko na to ng tama kasi si Doc Jhason yung nagturo sa akin nito, no? So, if we have, maintenance medication for high blood, Sir Dexter, it's important for us to continue taking our maintenance medication kahit na nag 120 pa yung 120/80 pa yung BP natin, because what we want to prevent is yung complications that would arise from uncontrolled BP, no? Hindi po dahil nag-normal na yung BP natin ay nawala na yung high blood natin, no? When we're not maintained on medications, maaari po kasing hindi makontrol yung BP natin. It can have complications. Number 1, cardiovascular. Number 2, kidney, no? And those are the things that we want to be able to prevent, kasi kung matamaan po yung mga organ systems that would involve that, mas mahirap po siyang i-treat, especially when we have that. And number 3, most importantly, nakalimutan ko, stroke, one of the risk factors for stroke actually is your uncontrolled blood pressure. So, Doc Jhason, nasagot ko ba ng tama? I remember this, sinanong ko talaga
Very proud teacher.
Yeah. So, siguro, we can ask Nurse Benj, ano ba yung mga techniques na ginagamit natin para makumbinsi yung mga pasyente na, kasi kalimitan sinasabi nila na pag na-hit ko na yan, sige na para makatipid. No? So, alam ko ang daming mental gymnastics na ginagawa ng mga nurses, lalo na pag nasa health center, kapag nasa ospital, pag nag-endorse ka na magdi-discharge na, pag-endorse ka ng mga gamot nila. Anything that you would like to add dun sa mga nabanggit nila, Doc Via?
Yeah. You know what, Doc Dex, it's a funny story kasi it happens. Bakit natutuwa tayo? Kasi madalas nating ma-experience dito sa community. As a nurses, we expose in different areas, not only in the hospitals but in community. Na ito yung paulit-ulit na mga scenarios na kukuha natin sa mga pasyente natin. Based on our assessment, ito po yung mga palaging nangyayari. You know what? I just want to share. Actually, naka-t-shirt pa po ako. I came from a vaccination this morning. Actually, it's a whole day. And part of the vaccination team, or as part of the vaccination team kasi on the screening, I experienced a patient ngayon lang na nag-stop na siya ng maintenance niya for 15 years. He's 51 years old for this at the moment, and kasi sabi niya tinigil niya na yung maintenance niya kasi wala naman siyang nararamdaman. And it happens that during the initial assessment or during the vital signs taking, yung BP niya from 180 to 120, pinag-rest namin siya, it turns down 160 to 100. And parang ako in the screening area, parang ayaw ko siyang i-clear kasi it's not normal. And the fact that he stopped the maintenance for several years ago, and I asked a specialty from the anesthesia service if we're going to clear this patient to get vaccinated. Kasi nga po, with the condition and the history na experience niya, yun po yung nakakalungkot lang din kasi maybe, I don't know if there's some misunderstanding between the health teaching, either a nurse or a doctor, na baka hindi kasi naintindihan ng mga pasyente during our assessment or during our care the importance of maintenance medication, na hindi po dapat pwedeng abruptly or basta-basta lang itigil yun. Kasi, it takes, a lot of assessment or diagnosis before we stop certain maintenance medication. So yun na po kasi, yun po as mentioned by Dr. Villana, talagang marami pong mangyayari if we do it. And yun nga po, I guess this program, it gives a best realization to all of the listeners or to all of the patients, to all of the communities na ganun po ka-importante yung isang medication. Kasi yun nga po, yun nga, based on my experience, na kwento ko po na I came from a vaccination this day, we were focusing on the herd immunity of all. And yun po kasi, mahirap po kasi na kapag, gumawa tayo or nagbigay tayo ng desisyon, relatedly sa health natin na without the expertise of our doctors, the expertise of our medical experts, malaking magiging problema po natin in the future eh. So, yun lang po na sana malaman po ng lahat yon, and the importance of, religiously taking the maintenance na sinasabi. And dapat before we did something, dapat talagang there's someone from the expert. Yun po.
Yeah, thank you for that, Nars Benj. Very important to consult your doctor or ask a health professional, our nurses and our allied medical professionals for advice, lalo na before you do any interventions na related sa healthcare. At ang maganda po dyan, mag-segue tayo na mabilis lang to our very special segment, Alagang Hello Doctor. Yan. So this is Alagang Hello Doctor, and we will be featuring the article of the week. So as you mentioned before, Alaga Health is in partnership with Hello Doctor, which is the Philippine-based hub ng Hello Health Group, which is present in over 9 countries. And of all of the health companies that they can partner with, they chose to team up with Alaga Health. So we're very, very thankful for that partnership. At ito, yung featured article natin sa kanila for the week, ito, home safety rules for preschoolers. Kasi may nagbanggit kanina on how to baby-proof somehow their home. So, ang maganda po kasi sa Hello Doctor, they're written by our authors here, but medically reviewed and verified by a health professional. So, the content that you can see here, nako, very accurate siya. And we're actually inviting our fellow health professionals to come in and team up with us also so that you can become part of the Alaga Health Hello Doctor team. And yan, in-explain why home safety is important, yung mga issues natin dito, falls, and even yung mga issues on choking, yung mga little pieces that pwedeng maswallow ng mga babies at mga kids, strangling, poisoning, these are hazards, no? Electrical shock. Ito yung mga binabanggit ni Doc Jhason kanina na remove the hazard. Pag naisip mo ng possible siyang danger, nako, intervene na even before it happens. So you can read the entirety of the article here in hellodoctor.com.ph, and you can even check out the other articles that they have tackling other specializations, no, apart from occupational health, here lang sa hellodoctor.com.ph. So, for your health information, you can go to hellodoctor.com.ph, and for your health services, you can go to alagahealth.com. So, you can check again our partner app and even our application that's available already in Google Play and soon iOS. Yan. So we're very, very excited to share that with you. So balik tayo. We still have a few minutes left. Let's jump right to it. No? Ito, habol ng mga questions. Actually, we have some questions din sa audience, our comment section, and we'll get to that. If not today, we'll be sure to answer them soon. Kasi, sige, banggitin ko na siya ngayon. Itong question na to ay from Ma'am Jeneline Panerio Empeño. So sabi niya, gusto ko lang pong malaman tungkol sa anxiety ko po. Gusto ko mawala na po kasi may time po takot ako na lumabas. Yan yung sabi ni Ma'am Jeneline. No? So Ma'am Jeneline, this is gearing more towards mental health and hopefully managing of stress. And ang advice namin, of course, is for you to hopefully use yung ating mga coping mechanisms, healthy coping mechanisms to manage anxiety, and of course, consult with a health professional. Ang maganda, Ma'am Jeneline, you can actually join us again on Friday this week, kasi every Friday naman siya, ang happy hour for mental health. So, libreng konsulta din yon. You can reach out to our now resident celebrity psychiatrist, Dr. John Referial, and you can get all of your questions answered on that program. So hopefully you can join us there also. But don't worry, we'll respond to your question to the comments in just a bit. Pero tanong tayo dun sa isa pa nating question from the inbox. From Ma'am Elise Magnayon. So, Elise Magnayon and Leandro Barella. So, parang same nature siya, no? Si Ma'am Elise sabi niya, hello po, Alaga Health. Pwede pa rin po bang mag-home care yung nanay ko po? Takot po kasi po akong magka-COVID po si nanay, di ko pa siya madala sa hospital. Na parang similar din yung tanong ni Sir Leandro Barella, hirap pong pumunta sa hospital ngayon. Salamat po dito. So I think the show. So thank you so for watching. Pero pwede pa rin po bang pumunta ng hospital ng hindi nako-COVID? Salamat po. Okay, so quick responses tayo, mag-round table from Doc Via to Doc Jhason and even Nars Benj na nasa frontlines also. So quick response, Doc Via.
Okay, so this one is related to my answer here. Marirelate ko sa nangyari sa akin the past week. No? So I had to manage a patient remotely, no, na may COVID, and elderly patient siya. No? So because the hospitals are now overwhelmed, no, what we had to do was we had to set up a home care in from where she's staying, kung saan siya nagsistay. So one of the things that was needed especially is for monitoring, number one, yung O2 sat ng ating pasyente, na especially if we have a patient na may COVID. No? Kung sakaling may COVID yung pasyente natin, number one, no, it's important for us to have monitoring mechanisms, no, especially with the O2 sat. So may pulse oximeter kaming available, no, in the home. And then number two, no, there's an O2 supplement, O2 supply ready, no, just in case bumaba yung O2 niya. And then number three, no, and very importantly, no, it's important for us actually na meron tayong connection or a way of communicating dun sa mga doctor natin, na kahit you cannot visit them, no, or you cannot go to the hospital directly, meron kayong open communication line with your doctor, especially when you have a patient na may comorbids na who contracted COVID-19. So medyo tricky talaga siya, no? There's no easy way for us to be able to manage that. But preparations are really needed when you would decide to have home care para sa mga pasyente natin na may COVID, no, or may other comorbidities, because wala pong means to go to the hospital, no? Pero it's very, very, very challenging. Medyo mahirap po siya. And you would need advice from your doctors, from your medical professionals, from your nurses. No? And I think Doc Jhason and Nurse Benj can actually weigh in on this issue. Kasi ito ata yung issue talaga natin ngayon, Doc Dex, because the hospitals are really full. Yeah.
Correct. So let's go to Doc Jhason, no? Doc, any advice po? Is it still safe daw po to go to the hospital for any condition ngayong may COVID na I think they're very scared kasi baka mahawa, ma-expose sa travel, etc.?
Yeah. Actually, the short answer is yes. No? Pwede pa rin naman pumunta sa hospitals. But may caveat po yun. Meron yung parang kondisyon. No? Siguraduhin po natin na talagang dapat ang kondisyon nyo ay talagang dapat po sa ospital po mamamanage. Ang advantage po talaga natin ngayon, no, na-realize natin na kaya pala natin, maraming proseso na kaya natin sa bahay. At kasama ang medical consultation. No, ngayon, napopromote na ang telemedicine. So, better magpakonsulta pa rin kayo. Sabi nga ni Doc Via, better na isik niyo muna ang advice ng medical professional. Kung sinabi talaga ng medical professional na pumunta ka sa ospital, COVID man yan o hindi, yun po ang nararapat. Pero kung hindi, pwede naman po, may advice din po kayo for po.
Yeah, so any quick response or follow-up, Nurse Benj?
Yeah, Doc, I guess this is the purpose of your of this advocacy. Kasi in this in the situation that we're currently facing right now, a lot of people are afraid to go to the hospital. And if they have the option to have this kind of platform, the Alaga Health, and this is the best way to share this platform to their family, to their friends, or everyone that they can interact to share this tool. Kasi yun nga po, if the reality yun nga po is dahil yung hospital, as mentioned by Dr. Via, na talagang overwhelmed na, the hospital are full. We can see it in the news. Na if we can have the way na to have this or to maximize this kind of tool, like the Alaga Health or some of the teleconsult or online platform na somehow na ma-address yung health concern nila, that's the big way na somehow magiging okay sila. And all of the hospitals, sobrang ma-appreciate po natin yun na kapag they're considering the healthy of our patient, not only for the patient, the health of their health workers, the health of the patient's relative. Kasi sobrang nag-iba po talaga yung uh, yung production or yung the procedure ng every hospitals. But we cannot deny the fact na that not all of this are safe. I mean, meron at meron talaga mamimiss natin. And at least we're lucky if we can go to some institution na talagang sinusunod nila yung tamang proseso, not for us to be safe if we go to their institution. So yun nga po, but if meron po na ma-maximize po natin yung ganitong platform na somehow we can recover and we get well using this way, malaking bagay po yun. And again, dapat po sinishare po natin yung mga ganitong information for us to be healthy, also for our family and for the community's health. Yan po.
Thank you very much, Nars Benj. So buti na lang, thank you for promoting us also. But a special shout out to our friends from Rotary Club, no? Na I think that's doon nang galing si Nars Benj ngayon sa vaccination nila. And they will soon become partners of Alaga Health, no? For onboarding also as our dear partner patients as well as champions of health. Yan. So since nabanggit na kung paano daw tayo magkakaroon sa other health services, let us show everyone here how Alaga Health can help you. So let's play that video just quickly. There you have it. You can now use the app. You can now use your laptop or any other electronic device that's internet enabled to access all of these services. And hopefully you will become part of the Alaga family soon. And for our health professionals, ang maganda dito, if you own a clinic, you can keep your brand. It's still there. Your personal profile will also be customized to your personal liking. And of course, special benefits to our partners and friends will be provided soon. Especially that in the coming weeks, we will be launching a major program with the Philippine Association of Patient Organizations. Nako, malaking partnership po yan. And we hope to announce it here very, very soon. So, with that being said, I think it's time to, lagpas 9 o'clock na pala. I think it's time really for the Alaga Health wrap-up. Now, we know you still have a lot of questions, and don't worry, we'll still reply to them through the inbox and through the comment section. But for now, due to our short time together, maybe it's time to get the final thoughts of our guests and, of course, my co-host this evening. So, Doc Via, any final thoughts and final words?
All right, so I'll keep this message short, but sweet. One of the things that I actually want to be able to convey sa mga manonood natin and of course sa mga sumusubaybay sa Alaga Health would always be that alagaan po natin ang ating sarili, kasi yun lamang po ang ating weapon, yung ating sandata laban sa sakit, and we should always take care of our well-being, not just physically, mentally, emotionally, socially. No, we live in challenging times right now, and everything is uncertain. No? So important for us, no, to be able to care for ourselves para maalagaan din natin ang ating mga mahal sa buhay. So muli po, salamat po sa lahat ng sumusubaybay sa Alaga Health. No, magkita-kita po tayo ulit next week, no, for another Alaga Health Live Checkup and of course Happy Hour. No? Salamat po sa lahat ng manonood.
Thank you, Doc Via. Now let's ask Nurse Benj. Any final thoughts or advice to our viewers tonight?
Yeah. So, Doc Dex, again, sobrang thankful po ako na naging part po ako ng program ngayon and to the rest of the team. Well, siguro naman, yun nga, as what I am experiencing at this time or at this today, yun po, sana po everyone will get vaccinated. And, it is very, important yung video presentation prior this event that promoting the herd immunity or the vaccination. Well, nakakalungkot lang na yung iba kasi if we see the ratio, and that's the reality, not only by research, but the factual data that all of the ICU patients are not vaccinated. Most of the ICU patients are not vaccinated. Most of the admitted patients are not vaccinated. Yun po talaga, ganun po ka-importante yung power ng vaccination. And I hope everyone, if there's a chance, if they have the capacity to be vaccinated in any brand, sana po magawa nila yon. And of course, sobrang thankful pa ako to be part of this advocacy for the health of everyone. Not only promoting some services, but of course, the main objective of this program is to give or to help everyone the best platform for them to get to know what about health, how they can take care of their health, how to give importance with the health. Kasi at this point, I guess, kung hindi natin bibigyan ng importansya yung kalusugan natin from the previous years, baka it's time na tingnan natin yung importance ng our health. Kasi kapag yun po yung nako-compromise in our life, in our system, in our life, talagang malaking bagay, malaking kawala po yun kapag napabayaan po natin. So I guess, yun nga, as I mentioned earlier, na sana i-share po natin yung good news na to, yung best platform not only for ourselves, but also to our family, to everyone, na as possible ma-share po nila yung ganitong way para at least hindi lang tayo makaka-benefit sa ganitong program, but everyone, para po sa not only for the nation health, but for the worldwide health. So again, salamat po and sana po palagi po tayong malakas at malusog.
Thank you very much, Nurse Benj. Now let's go
at
to...
we're experiencing right now. Yun lang po.
Yes, thank you so much. I really appreciate you joining us this evening. Lalong-lalo na special shoutout again to Rotary Club of the Philippines. No? Now let's get the final thoughts of Doc Jhason. But before that, I'd like to thank all of our viewers who continue to share and watch this program. No, particularly we love it when we see the spike that happens a couple of days after we share this. Kasi doon pala sinishare ng ating mga viewers sa kanilang mga kapamilya after watching this program, after viewing it ng Saturday and even Sunday. So really, really thankful for that power of social media. So now, for his final thoughts, Doc Jhason.
First of all, thank you very much, Doc Dex, Doc Via, and the Alaga Health team. Very, very, very helpful ang platform na to in your advocacy. No? And hindi ko na ulitin yung mga sinabi nila Doc Via at saka nila Nurse Benj. No? But jumping off from sinabi ni Doc Via, that we really live ngayon sa uncertain times. No? Marami talagang mga factors na hindi natin makokontrol. To be honest, even if all those protocols are in place, pero pag hindi po tayo sumusunod, baliwala po lahat yan. So at the end of the day, yung talagang attitude po natin, no? And simple lang naman we need to think always sa posible, no? Sa posibleng mahawahan ng sakit. So tatandaan po natin na talagang disiplina ang kailangan para sakit di madapuan. Salamat again and good night.
Thank you very much, Doc Jhason. And ako, we have reached again the end of our show. We're very thankful po sa lahat ng ating mga viewers. At natapos na naman po ang isang oras ng masayang usapan at libreng konsultasyon dito lamang po sa Alaga Health Live Check-up. And please join us again this coming Friday for our Happy Hour for Mental Health program. And of course, no, next Saturday, dahil maganda po yung ating topic, because next Saturday, lahat po ng mga may karamdaman o condition na related sa dugo, in celebration of Blood Diseases Month, may mga kasama po tayo dito, mga hematologists at mga internal medicine consultants na magbibigay sa inyo ng ideya kung paano natin ma-manage ang mga diseases like iron deficiency, hemophilia, among so many other things. At of course, no, this is me again, Doc Dexter Galban, reminding everyone na alagaan ang inyong kalusugan para mas mapaunlad ang ating bayan. So see you all again here next week sa Alaga Health Live Checkup. Goodbye! Thank you. Good evening!